the basic brushes, you have a curry comb. You go in a circular pattern and it helps loosen hair to get it off of their body. And then you can go with a hard brush to help smooth the hair back out. You always want to brush with the hair. You have a soft brush, which is soft enough to go on their face. And then you have a hoof pick with a brush to clean their feet. And you always want to stand to the side. Reach down. Nope. And you want to go on either side of their frog and just clean all the debris out. You can use a brush to help get it out more. You can let them put their foot down. For a twitch, you gather their lip skin right here and you put the twitch around it and tighten it up so it will be twitched like this. And most of them have a handle on it, but you want to hold the end of the handle back here so you have leverage, and that way they don't whack you in the face with it. The neck twitch, you grab some skin and roll it in. And you just grab it and roll it, and that's the neck twitch. For the mandibular pulse, it's right inside their cheekbone. You just put light pressure and you can feel it. When you listen to a horse, when you're listening to their respiration, their lung field is very big, so you've got to listen to all of it. So you listen to your respirations here, up here. You got to make sure you go all the way back to here. When you listen to their belly, here. And you can listen down under here. And you'd repeat it on the other side. For assessing hydration, you can touch their mucous membranes to make sure that they're wet and they're not tacky or sticky, because that would mean that they're dehydrated. You can also look at their skin. If you pull their skin, how hers bounces right back, she's not dehydrated. But if it stayed pinched out like this, that would show that she could be dehydrated. To assess their mucous membrane color, you want to make sure that they're a coral pink, which she is. And to check capillary refill time, you'd press and release and count the seconds that it would take to go back to pink. And hers is less than 2, which is good. For dental care for their teeth, you would either get your equine veterinarian or your equine dental technician to come out, and they would float the teeth. They have big long metal tools that file the teeth down, because their teeth, when they chew side to side, so their teeth wear uneven. So about every year to 2 years, you have to call them, and they come out and they'll file the teeth down so that they're nice and level and they have a flat, level surface to chew on. If they start dropping grain, you notice little chunks of hay in the stall that are wet and just rolled together all over the stall, which is called quitting. They could have issues with their teeth. If they're dropping weight or just not eating in general, they could have an issue with their teeth, so you would need to call one of them to come out and fix it. For jugular blood collection, you want to go right in here and press your finger in, and you can see where it pops out. I'll do it one more time. Wozo. And it pops out right there, and that's where you would stick. But when you go to stick for a jugular, whether you're getting blood or you are giving an injection, you want to make sure that you see the vein pop up, and with your needle you want to go pretty much parallel and flush with her neck, because if you go too deep, you can hit the artery, which you don't want to inject medication into the artery, and you don't really want to pull blood from the artery. So you want to keep your syringe level when you're going to go into the jugular, whether you are pulling blood or you're giving an injection, because if you go this way, you're going to hit the artery. So you want to stay level with the skin and the neck. If you needed to get blood from the transverse facial vein, it runs right here, about 2 centimeters underneath their cheekbone, and that's where you would get it from if you needed to get it there. When you do an intramuscular injection, you want to come right here in this little triangle, because that's where their muscle is. When you go to give the injection, a lot of times you can poke them to kind of desensitize them, or you can pinch right behind where you would give the injection, just to kind of distract them a little bit so they're not thinking about it. When you give a horse dewormer, it's always a good idea to weigh them. This is a weight tape. You can get them from any tack store. One side has where you can measure them to see how tall they are, and then the other side has the weight ranges. So what you do is, where you place the weight tape is just above their withers, and you come right where the girth goes, right where their heart is. Oops. And then what you do is you pull it kind of tight. I mean, not extremely tight. And where the weight tape ends is about how much they weigh. So she weighs about 850. So now that we know how much she weighs, we can give her the correct dosage of dewormer. So it is a paste, so you twist the little stopper and you'd bring it up to about 850, because there's 1,000, so that would be 950, 850, and you turn it so it stops it. Now what you do is you put it in the corner of their mouth and try and go back as far as you can. Depress it and then hold their head up, so that way when they swallow it and they start moving their tongue around, it doesn't fall all out on the ground, and that way they swallow it. If a vet needs to put in a nasogastric tube to either give medications when they are colicking, or to pull out reflux because it's building up in their belly, you'd have to, kind of hold their nose. Most of the time they're twitched, and you'd have the long tube. You'd put lube on the end of it, and you just slowly feed it up into their nose, and then once it gets back to here, you wait for them to swallow, and then you keep feeding it down, and once it gets to the stomach, you'll be able, you can smell it when it's in the stomach, and but you'd be able to tell if you got it in the trachea, because they would be coughing. But that's the key part, is once you get here, you wait for them to swallow it, and then you can actually see it going down their esophagus when you're getting it in there, so then you know that it's where it's supposed to be. For checking the digital pulses for a horse, you just want to run your leg down, and you can feel right here where their pulse is. You don't want to press hard, but you can touch it and you can feel their digital pulses. You want to make sure that they're not bounding. If they're very hard and you can feel them and it's called bounding, then that could mean that they have a problem in their leg or in their hoof if they're hot. But so you want to be able to just barely feel these pulses and not have them be thumping your fingers back and forth. I'm going to apply a standing leg wrap. Now this wrap is a little bit too big for her because it comes up above her knee and down past her fetlock. But what you want to do is you always want to wrap from the front around to the back, and you want to make sure that this is nice and tight and flat up against her leg so that there's no creases in it. And once you have that, then you apply the outer bandage, and that is the same. You go from the front to the back. You want to start in the middle and go up and then go back down. And when you go to tighten it, you want to tighten from the front. That way you're not putting excess pressure on their tendons, to keep the bandage nice and tight. You want to make sure this bandage doesn't have any creases in it. Going back down. And that is a standing leg wrap. To apply a stable wrap, you don't need the cotton, but you do it in the same fashion of you start it with the front rolling to the back, and you just want to make sure you keep it nice and flat. You come to just under the knee, to just above the fetlock. And there is the stable wrap. When you're taking a temperature on a horse, you always want to stand to the side. You don't want to be directly behind them because they can kick you. Also, they cannot see you if you're directly behind them. To do a temperature, you have to get a little bit of lube on your thermometer. You want to make sure you hold it when you take their temperature, because the thermometer can get sucked in. So either you want to sit here and hold it, or a lot of times they'll have little clips on them so you can clip them onto their tail. That way you can go do other things while it's reading their temperature. To apply a tail wrap, you want to make sure you get as far up as you can, and you don't want to go past the base of the tail where the bone is. This helps keep the tail out of the way and clean for procedures. So you have to make sure you get it good and tight at the top. That way it helps hold it. You want to make sure you keep feeling so you don't go past that bone. And that's where the end of her bone is. So then you start going back up. That way it keeps her tail out of the way and clean so they can do procedures and check things. And then to take it off, just slide it down. When you lead a horse, you always want to be on the left side. And you walk them into the stall. You always want to turn them around and walk back to the door so that you're facing the door. And then you can take the clip off and take their halter off. For horses, when they're in the stalls, you have to clean out the manure and the urine. You can either use straw or shavings for their bedding. You need a pitchfork to be able to scoop it out. And then you need your manure bucket. Obviously, when it's full, you would take it out and dump it in your designated manure spot. Most of the time after you clean the stall, you have to replace some of the bedding because you're taking the soiled bedding out. So therefore, you would put in new shavings or new straw and get the stall level so that it's nice and clean. If you were traveling to different farms and you needed to worry about biosecurity, you'd have a bucket with water and iodine in it and one of the hard bristled scrub brushes that you could dip into the bucket and scrub your boots off once you're away from the farm before you get in your truck. That way you're not transferring disease from one farm to another.